Alcohol is a psychoactive substance that has widespread acceptance in many cultures around the world. While moderate consumption may be socially or even medically tolerated in certain cases, alcohol poses serious health risks and social consequences when misused. Health effects of alcohol: physical health. Liver damage. Prolonged alcohol use can lead to fatty liver, hepatitis, fibrosis, and ultimately cirrhosis, heart disease. Heavy drinking increases the risk of high blood pressure, irregular heartbeat, cardiomyopathy, and stroke. Alcohol is classified as a Group 1 carcinogen. It increases the risk of cancers of the mouth, esophagus, throat, liver, colon, and breast. Alcohol interferes with neurotransmitters, and long-term use can cause memory loss, cognitive decline, and brain shrinkage. Frequent drinking can suppress immune function, increasing susceptibility to infections. Alcohol is a central nervous system depressant. It is associated with depression, anxiety, and increased risk of suicide. Dependence and addiction, known as alcohol use disorder, can develop, leading to cravings, tolerance, and withdrawal symptoms. Alcohol affects fertility in both men and women. In pregnancy, alcohol can cause miscarriage, stillbirth, and fetal alcohol spectrum disorders, which are lifelong conditions that affect a child's physical and mental development. Social and economic impact: accidents and injuries. Alcohol is a leading cause of traffic accidents, drownings, falls, and other injuries, violence and crime. A large proportion of domestic violence, assaults, and homicides involve alcohol. Workplace issues. Alcohol use is associated with absenteeism, reduced productivity, and workplace accident. Economic cost. Globally, alcohol misuse contributes to billions of dollars in healthcare costs, law enforcement, and lost productivity. Types of alcoholic beverages and their relative harm. The harm of an alcoholic beverage depends largely on its alcohol by volume, how much is consumed, and how often. Here's a breakdown. E-beer. Alcohol by volume is typically 4 to 6%. Description: made from fermented grains like barley or wheat. Most common types include lager, ale, and stout. Harm level: often perceived as milder due to low alcohol by volume, but heavy beer consumption is associated with obesity, liver disease, and alcohol dependency. Wine. Alcohol by volume, or ABV, typically ranges from 9 to 15%. Wine is fermented from grapes or other fruits and includes varieties like red, white, rose, and fortified wines such as sherry or port. Some studies suggest that small amounts of red wine might have cardiovascular benefits. However, regular drinking increases the risk of cancer, especially breast and liver cancer. Spirits, also known as liquor. The ABV typically ranges from 35 to 50%, but it can be higher. Spirits are distilled from grains, fruits, or vegetables and include types like vodka, whiskey, rum, gin, tequila, and brandy. Due to their high ABV, spirits can cause greater intoxication per volume, making it easier to overdose. They also have a stronger association with alcohol poisoning and dependency. Ready-to-drink beverages. The ABV typically ranges from 4 to 7%. These are pre-mixed alcoholic drinks, like cocktails in a can or hard seltzers. They are often marketed as casual or fun drinks, which can lead to binge drinking, especially among younger populations. Fortified wines have an alcohol by volume, or ABV, of 15 to 22%. These are wines with added distilled alcohol, such as port or vermouth. They tend to have higher levels of sugar and alcohol, which can increase the risk of liver and heart issues with regular use. Liqueurs. These beverages have an alcohol by volume, or ABV, ranging from 15 to 30%. They are flavored and sweetened distilled spirits, like Baileys or Amaretto. Their high sugar and alcohol content make them particularly dangerous when consumed in large quantities. No type of alcohol is safe when consumed in excess or habitually. The frequency, quantity, and the context of drinking matter more than the type. Alcohol affects everyone differently. Genetics, gender, age, and health conditions all play a role. Even light or moderate drinking has been associated with health risks in recent studies.